What's good, YouTube? It's Jay again, and I'm back again with another video. I'd like to welcome you to Respiratory Therapy Essentials for the TMC exam. Now, tonight is a different video because with all the information that we're giving you, we're going to begin to put these in question form as you will see them on the TMC exam. I also cut a video titled Mechanical Ventilation Q&A. All of the questions pertaining to the information that we have given you and information that would appear on the exam. Tonight, the questioning that we would like to share with you concerning management of the mechanical ventilator patient. You must know how to manage the patient, and you must be able to answer these type of questions on the TMC exam. Are you ready to go? Let's do this. Okay, guys, working from left to right on the board, and in the center of the board, you will see we're talking about management of the mechanical ventilator patient. Every respiratory therapist must know how to manage the patient on the ventilator. And these are the type of questions that you're going to see and that you're going to have to deal with. Starting at room number 1, permissive hypercapnia is a technique used to increase, the answer is the PCO2, and to reduce pulmonary pressure. CPAP and PEEP may be used to correct refractory hypoxemia caused by intropulmonary shunting. What type of ventilation is used to wean the patient from mechanical ventilation? Pressure support. And pressure support should start at around 10 centimeters of water pressure up to 15. When the ventilator rate is greater than 20, what may occur? This will cause auto-PEEP. The incidence of ventilator-induced lung injury may be reduced how? By keeping the plateau pressure below 35 centimeters of water. What is optimal PEEP? Optimal PEEP is the amount of PEEP that delivers the greatest amount of oxygenation. Higher doesn't mean better. Use what you need to help the patient. Roman number 2, a common application of RV ventilation is the treatment of what? ARDS patients. What are 3 goals of prone positioning? We use prone positioning to improve oxygenation, to reduce peak pressures, and to reduce plateau pressure. What needs to be done if the patient is hypoventilating on the ventilator? You need to increase the respiratory rate or increase the tidal volume. What increases the likelihood of oxygen toxicity? An FiO2 of 100% for a period between 12 and 24 hours. What are 2 ways pressure support are used? Pressure support is used to overcome the resistance of the ET tube or when used to target a tidal volume. What do we want the FiO2 to be before we extubate a patient? Before we extubate a patient, we should have an FiO2 of 40%. Roman number 3, what should the FiO2 be before using PEEP? The FiO2 should be at least 60%. That's our cutoff before adding PEEP. Increasing the inspiratory flow rate on the ventilator does what? If you increase the inspiratory flow rate, this will decrease I time, increase the E time, allowing time for exhalation. Auto PEEP may be reduced by decreasing the tidal volume, decreasing the respiratory rate, or increasing the inspiratory flow rate. What percent of FiO2 is not good? Whenever you have to use an FiO2 of 50%, that's not good. The ventilator circuit should be changed. You should only change the ventilator circuit when it's visibly soiled with blood or mucus. And there you have it. Okay, guys. Of course, you know there are tons of questions about management of mechanical ventilation. I'm only sharing with you a few of the questions that I know that will appear on the test, things that I've seen and know that you should know. But you should know every single thing you possibly can concerning management of mechanical ventilation. But I can assure you guys that the information that I'm giving you will help you tremendously. I took this test 3 times, and I do know you can't cheat this test. You have to know what you're doing, okay? Good luck to you. Hey guys, listen, I'm working hard to earn your subscription. If you would, hit that like button, subscribe to my channel, turn on the post notification bell because I'm giving you 1 or 2 videos every single week. My next video, along with this management of mechanical ventilation, is going to be mechanical ventilation Q&A. You ought to watch that video. You will learn something. Until next time, we out.